His name is Dr. Vinesh Ram. He's an MBBS. He's IFAAM, FIPM, in pain and aesthetic physician, specializing in hyperbaric medicine, focusing more on the chronic pain and pelvic pain. He's also the founder of Pelvic Pain India. He's a managing director at Eliva Hyperbarics and Health. His topic for today is HBOT for health and anti-aging. He's going to give you an overview and a main understanding what HBOT really stands for. Over to you, Dr. Vinesh.
Good evening, all.
Good evening, good evening. Yeah, we can see your slide. You can go, sir. Please.
Yeah. Good evening, everyone. I'm going to talk about hyperbaric oxygen therapy, which is HBOT for health and anti-aging.
So we cannot see your video. Could you please on your video?
Hello.
Yeah, we can hear you, but your video is not visible. Is that okay for you?
No, I mean,
Yes,
just
please.
1 sec. I'm just
Yeah.
there's an unexpected error with Zoom.
Yeah. Please.
Is it visible now?
Yeah. So your screen is visible. Your video is not visible, but that should be.
Okay. I'll just go ahead then.
Yeah. Go ahead, sir. Please go ahead.
We can define health as a state of complete physical, mental, and social well-being, not merely the absence of disease. So good health is essential for handling our day-to-day stresses in life and living a more active social life as well. It is a concept which encompasses various aspects of emotional, mental, and physical well-being. To preserve good health, it is important that we maintain a healthy lifestyle by engaging in activities like regular exercise, the proper balanced nutrition, and 6 to 8 hours of regular sleep. And it is also crucial that we take medical advice whenever it's needed for maintaining our physical, mental, and emotional well-being. So healthy living is a way of living that lowers our risk of being seriously ill or chronically suffering. It also involves getting a physical health that includes mental and emotional well-being. Healthy living is a practice of implicating many behavioral and lifestyle changes. Some of the practices for healthy living are a balanced diet, which is rich in fruits, vegetables, whole fruits, and also avoiding foods that are high in trans fats, salt, and added sugars. Being physically active for around 150 minutes a week, that is 30 minutes a day, is more than sufficient, and this should also include muscle strength training. Enough sleep of at least 6 to 8 hours is mandatory for all adults. Managing stress in a healthy way is essential for maintaining a proper health. We can incorporate various techniques like meditation, yoga, breathing exercises, etc. Quitting smoking helps maintain a healthy life. Limiting our alcohol consumption is very important. Healthy living can help you not only to live longer, happier and healthier, but also reduces need for healthcare and to improve our quality of life. So let's look at what is aging. Aging is a natural process. It is characterized by accumulation of molecular and cellular damage that we accumulate over time, leading to decline in physical and mental ability, increased risk of disease, and ultimately death. In humans, aging encompasses physical, psychological, and social changes. It is common in health conditions associated with aging, which are like hearing loss, cataract, joint pains, obstructive lung diseases, diabetes, depression, dementia, and so on. So now the $1,000,000 question is, what is healthy aging? Healthy aging is the process of developing and maintaining functional ability that enables well-being in our older age. Healthy aging is not just being free of disease. The key considerations that one must look into for healthy aging will include diversity, equity, and environmental support with intrinsic capacity and functional ability. There is no person who is typically an older person. To promote healthy aging, it is important that we take care of our physical health by engaging in regular physical activity with a balanced diet and adequate rest. Additionally, it is also important to maintain good social connections. So the 7 pillars of aging. So these are all interconnected in every manner. So these things must be taken into care. That is adaptation to stress, which is the ability of cells and organisms to respond to stressors like heat, radiation, and toxins. Epigenetics is something where the study of genes, expression of genes comes into play. Inflammation, it is crucial in almost everyone's life because we all are having high load of inflammation because of our lifestyle and exposure to toxins. Macromolecular damage refers to damage to molecules in our body like proteins, lipids, and DNA that accumulates over time. Metabolism, the chemical processes that occur within the cells to maintain life. Metabolism is very important, and we all face a hike in metabolic disorders in this stage of life. Proteostasis, the maintenance of protein function and structure over time. Stem cell regeneration is very important. This denotes the ability of a body to repair itself. The basics of healthy aging, the basic foundations that is needed for a healthy aging or regular exercise, healthy balanced nutrition, weight management, adequate proper rest. We should all get at least 6 to 8 hours of sleep, and this sleep must be at a particular time to a particular time, ideally between 10:30 to 5:30. That's the best time for sleep. Stress management, we all should learn to manage our regular stresses with techniques like meditation, yoga, which also helps in reducing our inflammation and improves our overall well-being. By adopting these simple healthy habits, we can promote a healthy lifestyle and we can improve our aging process as well. So let's look at why we actually age. The hallmarks of aging are genetic instability, telomere attrition, that is shortening of the genes, epigenetic alterations, loss of proteostasis, that is balance of protein synthesis, dysregulated nutrient sensing, mitochondrial dysfunction, which happens because of exposure to all our lifestyle changes and also to the environmental toxins and stuff, cellular senescence, that is death of cells, stem cell exhaustion, and altered intracellular communication. So aging is the loss of physiological integrity, where our major pathologies like infections, cancer, diabetes, and all come into a play. Homeostasis is a biological phenomenon where we expose ourselves to low dose of stressors and stimulate our body's natural defense mechanism and promote healthy aging. The homeostasis theory of anti-aging suggests that there is a systematically introduced stressor which enables the heat shock proteins to be generated. This will activate the molecular pathways which delays aging. So exercise is one of the commonest hormetic agents that we can integrate into our lives. So other things that we can easily integrate include consuming collagen and yogurt with lactobacillus reuteri, which is a probiotic. So the most effective hormetic strategies are hyperbaric oxygen therapy, ozone therapy, light therapy, phytochemicals, breath work, which must be incorporated regularly, time restricted eating and fasting, regular exercises, which should include high intensity interval training and strength training as well. Cold plunges and far infrared saunas are also very useful hormetic strategies. So hyperbaric oxygen therapy is one of the modalities with help with living a healthy life and also in anti-aging. It has the ability to heal the body and provides invaluable resource in anti-aging. This works at a genetic level. So what is hyperbaric oxygen therapy? It is a medical treatment which involves breathing pure oxygen in a pressurized environment. The process is achieved in a specialized chamber, and the chamber is pressurized to very high pressures. That is, we call it like 1 atm is the normal atmospheric pressure. We go up to 2 and 3 atm based on the need of the patient. And under these pressures, the patient inhales 100% medical grade oxygen. So the absorption of oxygen is also very high under these pressures. HBOT is considered as an example of homeotic intervention because it exposes our body to mild stress, like increased pressure and exposure to pure oxygen. So here, the oxygen is administered under pressure, ideally above 1.5 ATA, that is 1.5 times atmospheric oxygen pressure. This enables oxygen to be dissolved in every fluid inside our body. Even plasma is enriched with oxygen, enabling oxygen to reach areas which are usually deficient in oxygen. Your body has the ability to heal, but we have to kindle it to do what is needed. Inside a hyperbaric chamber, a patient comfortably breathes 100% oxygen. They can relax reading a book and breathe in as usual. Nothing will be felt as such. This one session of hyperbaric oxygen we term it as a dive. So why would you need higher concentration of oxygen in our body? So under normal conditions, the oxygen in air is around 21%. But when we breathe 100% oxygen under very high pressures, and after each dive, the pressure on the oxygen saturation in our body increases by around 800 times. This can accelerate and enhance our body's healing ability, generate an environment which is enables healing, reduces inflammation, and there is extensive regenerative capacity that is increased multifold. So, in what is the normal physiology? The air that we breathe contains 21% oxygen at 180 A or at sea level. The tissues need oxygen and they get it through hemoglobin. So, any injury or disease or aging, there is a decrease in our body's ability to transport oxygen. This happens with aging as well. Increases in tissue demand for oxygen. There may be an increase in the distance that oxygen travels to from the capillary to the cell. So, how does hyperbaric oxygen therapy help? The major primary mechanism involved is hyperoxygenation or exposure to high grades of oxygen under pressure. In these pressures, there is a reduction in the bubble size, which enables oxygen to get dissolved in plasma as well. This hyperbaric oxygen therapy and this hyperbaric environment brings about angiogenesis, that is formation of new blood vessels. In areas where there is restriction of blood supply, you can form new blood vessels with this treatment. There is increased fibroblast proliferation, increase in collagen synthesis, new nerve cell formation occurs. Stem cells are what we call healers of our body because they can change into any cell that the body needs. So normally the stem cell count will be less, but under hyperbaric environment, after a proper set of treatments, the stem cells can increase by around 700 to 800 times. So also hyperbaric oxygen is very potent antimicrobial and it has antibiotic synergy, which improves the functioning of antibiotics. It reduces edema, that is extensive mitochondrial regeneration. It improves immunity. Inflammation is reduced multifold. It enhances leukocyte functioning, that is function of your white blood cells. That is, it stops reperfusion injuries. There is increased, reduced repeat peroxidation, and it also inhibits toxins produced by certain microbes. So the dosing, actually we use 100% oxygen, that is 99.9% pure medical grade oxygen. And usually the pressure is between 1.5 to 2.5 ATA, but the ideal recommended pressure will be around 1.8 to 3 ATA. The conditions what we treat decides the factor which pressure should be used. So delivery is the desired pressure will be reached around 10 to 15 minutes. We can't just walk in and walk out of a chamber just like that. So once the pressure is reached, we'll have to complete the treatment. And then after completing the treatment, it takes another 10-15 minutes to decompress and come back to normal pressure. Every 30 minutes, every 25 to 30 minutes, we give a 5-minute air break where pure oxygen is cut out and regular air is let in. So this is usually done 5 times a week. The usual therapeutic range is between 15 to 40 dives. And in a lot of other conditions, in rare pain disorders, the number of dives may increase even up to 80. Even in conditions like cerebral palsy, we can take up to 80 dives. So these are the FDA approved indications, which are for air and gas embolism, acute arterial insufficiency, diabetic wounds, and non-healing ulcers, where hyperbaric oxygen therapy not only helps in reducing the number of medications that a person consumes, but also reduces the risk of amputation by around 80%. That is acute traumatic peripheral ischemia. Decompression sickness is what the hyperbaric chamber was initially designed for, but later it came into use for various other functions. It is used in carbon monoxide poisoning. Osteoradionecrosis happens after radiation therapy for cancer. So crush injuries, skin grafts, and flaps to increase the uptake of skin flap and to prevent rejection. In osteomyelitis, where there is bone infection which doesn't respond to any antibiotics. Thermal burns, when there is extensive burns, it helps immensely in gas gangrene and necrotizing soft tissue infections and severe anemia. So the off-label indications for hyperbaric oxygen is extensive. We can use it for more than 300 plus indications. Commonly used indications include autism, cerebral palsy. It is very good in anti-aging. It is used for autoimmune disorders where it limits the progression of autoimmune disorders. It is used in embedded infections, chronic fatigue syndrome, chronic pain of unknown etiology, where the cause of the pain is unknown. It is very useful to go for hyperbaric oxygen therapy. In Crohn's disease and ulcerative colitis, diabetic foot, diabetic neuropathy, diabetic retinopathy. In erectile dysfunction, it gives amazing results because there is an endothelial dysfunction, and hyperbaric oxygen therapy improves endothelial dysfunction. Chronic pain disorders like fibromyalgia, interstitial cystitis, and again Lyme's disease. And it is also useful in migraine and cluster headaches. Insulin resistance is one condition that we face very commonly nowadays. I mean, the root cause of PCOD, PCOS, and in diabetes. So this improves insulin sensitivity. And again, multiple sclerosis, it helps in refractory depression and anxiety, which doesn't respond to medications. Non-healing ulcers of any origin, even venous ulcers, pre and post surgically. It is used pre and post surgery, like 5 sessions before a major surgery and 3 days after surgery, another 5 sessions reduces the risk of infections, improves the healing capacity of the patient, reduces hospitalization requirement, and it is also used pre and post chemotherapy and radiotherapy. This is to prime the tumor cells. Post-COVID and long COVID relief, it gives amazing results. Then it is used for sudden sensory neural hearing loss. It is useful in sports injuries, vasculitis, tinnitus, and in even general wellness. For hyperbaric oxygen therapy, how does it help in diabetes? It increases insulin sensitivity. The drop, I mean, for example, if a patient has a HbA1c level or glycosylated hemoglobin level of around 12, in as early as 8 to 10 sessions, the drop, I mean, the HbA1c level drops down to 9. There is improved pancreatic function. The diabetic neuropathy, the pain which people face with diabetes, is extensively improved. And in most cases, it almost vanishes in around 7 to 8 sessions. It corrects lipid and glucose metabolism. It helps in diabetic retinopathy, improves glucose tolerance, enhances endothelial functioning in microvascular disease of diabetes, reduces the risk of amputation with diabetic foot ulcers, and enhances healing of diabetic ulcers. The general protocol we follow is in people who are pre-diabetic, 20 to 40 1-hour dives 5 times a week. In early diabetics, 40 1-hour dives 5 times a week. Uncontrolled diabetics will need around 40 1.5-hour drives. That is also at 5 times a week. We can do 6 weeks, 6 sessions a week as well. In diabetic ulcers, the number of dives increase depending on the severity of the ulcer. So we can go for either 60 dives or in severe cases, we may need up to 60 dives. In cases where there are sinuses and well-established tracts inside the ulcer, we can go even higher, and even some may need up to 80 dives. And in long COVID and vaccine injury, hyperbaric oxygen therapy recovers the heart's ability to contract. So it improves the cardiac functioning. That is angiogenesis or new blood vessel formation, which improves the blood supply to heart tissues and throughout the body. Stem cell proliferation aids in recovery of damaged tissues. Neurogenesis, where there is new nerve tissue formation, improves brain recovery. It is a very potent anti-inflammatory and it reduces unwanted cytokines. Hyperoxygenation helps in depression and anxiety associated with long COVID. It reduces free radical damage, offers good pain relief, and the pain relief obtained can be equated to NSAIDs or commonly used painkillers. Effective virucidal helps in gut dysbiosis, enhances metabolic profile of the affected patient. The general protocol we follow for long COVID is around 20 to 30 1-hour dives. In extreme cases, we may need up to 40 dives. Hyperbaric oxygen therapy helps in both osteoarthritis and rheumatic arthritis. It provides effective pain relief. There is intense reduction in inflammation in both the conditions. And in rheumatic arthritis, the bone formation also happens if it is early. Muscle stiffness gets better faster. And there is collagen synthesis. There is regeneration of cartilage tissue. Tissue regeneration and stem cell proliferation occurs. And in rheumatoid arthritis, we can get immunomodulatory and limitation of progression in rheumatoid arthritis. Promotes faster recovery and early mobility of the patient. The general protocol we follow is for osteoarthritis, 20 to 25 1-hour dives. In rheumatoid arthritis, 30 to 40 1-hour dives. In extreme cases of rheumatoid arthritis, we can go for 40 1.5-hour dives. In psoriatic arthritis, it gives immense results because it has an immunomodulatory effect and also limits progression of autoimmune disorders. For psoriatic arthritis, we usually recommend 30 to 50 1-hour dives. So in stroke, hyperbaric oxygen therapy is useful both in ischemic and hemorrhagic stroke. It reduces the impact, the extent of damage. It is much less if done within the first 24 hours. If hyperbaric oxygen therapy is given within the first 6 hours of stroke, there is very limited damage to the patient following the stroke. This is because of edema reduction and it also prevents the spread of the stroke. The high pressure with oxygen limits the edema, arrests progression, and benefits are noted very early with hyperbaric oxygen therapy. There is reduced autophagy. Recovery of neural tissue is much faster and there is new nerve cell formation, stem cell proliferation. There is enhancements of stem cells which improves not only neural recovery but also in other parameters of health. Improved cognition and focus, neuroprotective and neuroregenerative, aids recovering muscle strength faster, enhanced neuroplasticity, improved quality of life. In cancer management, hyperbaric oxygen therapy finds a very good role. It is extremely safe for patients to go in for hyperbaric oxygen therapy. It is used to prime the cancer cells or the tumor cells before and after chemo or radiation therapy. It enhances the outcome with minimal side effects. Hypoxia is a hallmark of cancer, and hyperbaric oxygen therapy actually brings about hyperoxygenation, where there is increased oxygen supply. Increase in stem cells. Tumor inhibitory effect. Hyperoxygenation brings about tumor inhibition in itself. In a few cases of cancer, hyperbaric oxygen therapy is used as a standalone treatment for a few cases of mesotheliomas and gliomas. It reduces the inflammation and detoxifies the system. Reduced fatigue associated with chemotherapy. And post chemotherapy and radiation therapy, it is used to reduce the free radical damage, heal tissue injury, and to take away inflammation. In radiation injury, there is extensive damage, and in conditions like radiation cystitis, it gives about amazing recovery for the radiation wounds as well. The protocol followed depends on the severity of the patient. Usually, we recommend around 25 1-hour dives, and it can be up to 40 or 60 1.5-hour dives in cases of radiation cystitis and where there is extensive radiation necrosis and all. For chronic pain, in people who don't understand what may be causing the pain, that is like conditions like fibromyalgia, bladder pain syndrome, peripheral neuropathy, complex regional pain syndrome, chronic fatigue syndrome, etc. Even in migraine, HBOT gives very good pain relief. In there is edema reduction, which helps in making the patient mobile and easily ambulatory. Neuroplasticity helps in changing the way a person perceives pain. It also improves the pain threshold of a person. It addresses the depression and anxiety associated with almost everyone suffering from chronic pain. It improves cognitive functioning and improves focus and memory. There is sustained pain reduction and modulation of pain. It also switch off nociceptive pain. There is reduction and complete resolution of conditions like hyperalgesia, where the patient's response to pain is very high, and in conditions where the patient experiences altered pain sensations. Anti-inflammatory action reduces the inflammatory modulators, and also there is release of opioid peptides in our body, enhance circulation and muscle functioning. It also helps in post-traumatic stress disorder, which often is one of the root conditions, root causes of many chronic pain conditions. The general protocol depends, and usually for chronic pain, it needs at least 40 sessions of 1 hour dives, and we can go up to 2 hours of 40 1 hour dives. In obesity, hyperbaric oxygen therapy is found very useful because after each session of hyperbaric oxygen therapy, after each 1 hour diet, we burn around 500 to 800 calories. Along with calorie restriction and a proper nutritional diet, this can give an immense metabolic boost. Not only a metabolic boost, there will be a pronounced weight loss as well. Insulin sensitivity is increased. It addresses hyperlipidemia effectively, increases effectiveness of exercise, reduced fatigue after workout and improved energy levels, enhanced fat burning, enhances and corrects the metabolic insults usually at the root of obesity, reduces inflammation, which causes weight gain by itself, and also in patients who face weight loss plateaus, it breaks the plateau, helps maintain and prevent rebound weight gain. For weight loss, we recommend 30 to 40 dives. For weight loss plateaus, 10 to 15 1 hour dives. In patients who suffer from extreme weight loss plateaus where they are not able to lose weight, 10 to 15 dives helps break these plateaus. Now we go into HBOT for anti-aging. So the properties which help in anti-aging are stem cell stimulation, angiogenesis, where there is formation of new blood vessels, suppression
Vinesh,
of
4
cellular
minutes.
senescence, where the death of cells is suppressed. It's activated in the sense where old cells should die faster.
Yeah, Dr.
Telomere
Vinesh,
elongation, where the ends of genes that is,
excuse me,
all
Dr.
get
Vinesh.
shortened with age. Hyperbaric oxygen therapy works at a genetic level and improves telomere length. Free radical damage is reduced because of enhanced antioxidant activity. Inflammation is reduced. So these
Dr.
are the
Vinesh,
factors which cause extensive damage to a system and cause early aging. There will be telomere shortening, DNA damage, genetic expression errors, proteins become less functional as we age, and because of environmental exposure to toxins, cells don't die as they are supposed to. The body energy production is less, communication between the cells is less, there is improved metabol and there is an imbalance in the metabolism in the body, the stem cell levels are exhausted. Hyperbaric oxygen therapy works on all these parameters and improves it. So for healthy aging, for a person to work on anti-aging, he must address and prevent these chronic diseases which are on the rise. Hyperbaric oxygen therapy is effective in almost all these chronic diseases we face, like ALS, dementias, COPD, heart diseases, eating disorders, cancer, obesity, diabetes. It is very effective in all these conditions. So what causes premature aging? The most common cause we face
Dr.
today is
Vinesh,
unhealthy diet, too much of
can you hear
sitting.
me?
Yes, ma'am.
Yeah, Dr. Vinesh, yeah, 3 minutes to go, sir, right?
I'll finish it first.
Yeah. There are certain questions as well, those very interesting ones, if we can finish this a bit.
Sure, sure.
Okay, thank you.
too much alcohol. We must be familiar with all this. You can just have a look. I'm running short of time. How does HBOT help in anti-aging? So as I said, it improves telomeres in the genes and increases telomere length. So it works at a genetic level, improves vitality of all tissues in the body, improves cognition, that is memory, and boosts immunity multifold, very potent anti-inflammatory, improves the quality of blood cells and the blood vessels, very effective in post-traumatic stress disorder, rapidly improves the insulin sensitivity, promotes mitochondrial regeneration and recovery, inhibits photoaging. Photoaging is one of the major causes of aging, which is around 60% of aging. Increased collagen synthesis, which improves the skin health and joint health, removes senescent or dead cells in the brain through autophagy, reduces oxidative damage, improves our tolerance to stress and our ability to manage stress, improves our sleep, and helps in insomnia. So these are the various studies. There are more. I picked out a few, so you can all have a look at it. So our protocol for anti-aging, we usually recommend 60 sessions of 90 minutes. The ideal recommendation is 120 minutes of 60 sessions. Gut correction should be done. Proper diet is mandatory. 30 minutes of good physical activity daily. Far infrared sauna along with this hyperbaric oxygen therapy, 10 sessions. And after that, weekly sessions is advisable. Cold dips help a lot. Detoxification as needed. And IV nutrition will help. Thank you.
Yeah, thank you, Dr.
Any
Vinesh.
questions?
Yeah, I'll just run through the question. There's one important question everybody is asking. What is the cost per session of the HBOT?
Okay, the cost per session of HBOT varies from place to place. I am providing hyperbaric sessions at 3,000 to 3,500 for 1 hour, depending on the number of sessions.
Yeah,
And the cost goes up to 10,000 per session for 1 hour.
yeah. And one last,
Depends on the city where we practice.
yes,
Basically, that's how it works.
yeah. One last question and a quick one. Is HBOT better than the stem cell therapy in both effectiveness and the cost?
Stem cell therapy focuses mainly on stem cell activation alone. With hyperbaric oxygen therapy, you get all the other benefits. Whatever condition you get treated for, you get all the benefits of hyperbaric oxygen therapy.
Yeah, okay.
Whatever the benefit, you will reap everything, irrespective of the condition you are treated for.
Yeah. Does it help in avascular necrosis patients, varicose veins, and glaucoma?
Yes.
Yes, it does in all the conditions. I guess I've covered up three questions in one. And is there any role in type 1 diabetes in getting
Actually,
the
type 1
pancreatic?
diabetes, it does help improve the pancreatic functioning and improves the insulin sensitivity as well.
Yeah.
But
Okay.
there is no guarantee I can give from my experience. I've not treated many patients with type 1 diabetes, but with type 2, it gives amazing results. I've seen very good resolution of symptoms and reversal of disease.
Thank you so much, sir, for your insightful session. We'll move to the next speaker. Thank you so
Thank
much
you.
for joining us.